Welcome to Research Roundup by IBI, the podcast where we dive into the latest trends and research in the workplace health and productivity space. I am your host, Dr. Sarah Lee Gurulal. Each episode will bring you the most recent studies, insightful analyses, and actionable takeaways to help you create a healthier, more productive workplace. Whether you're an employer, a benefits consultant, or a vendor, this podcast is designed to keep you informed and ahead of the curve. Let's get started. Hi, everyone. Welcome to today's podcast. We're so excited to have you listening in. Today, we will be talking about some of the latest research published in June 2024 that we have shared in IBI's monthly research review email. Our first study today is entitled The Vanishing Applicant, Uncovering Aberrant Antecedents to Ghosting Behavior, published in the Journal of Organizational and Occupational Psychology. Now, we've all heard of ghosting in the dating world, but it's becoming a real issue in recruitment too. This research surveyed 352 U.S. workers and found that traits like psychopathy and the fear of missing out, or FOMO, predict ghosting behavior. Can you imagine that? Interestingly, if an applicant has been ghosted by an employer before, they're more likely to ghost in the future. It's a vicious cycle. Employers take note. Improving communication, fostering a positive company culture, and offering competitive compensation can help break this cycle. Think of it as relationship maintenance. It's all about keeping the lines of communication open and making the other party feel valued. Next up, we have a study from Health Affairs Symposium entitled Balancing Innovation and Affordability in Anti-Obesity Medication, the Role of an Alternative Weight Maintenance Program. This one's particularly relevant for those managing healthcare costs. The study used the Diabetes, Obesity, and Cardiovascular Disease microsimulation model to compare two weight maintenance strategies. Spoiler alert, the alternative, less expensive program offers significant lifetime healthcare cost savings, even though it's slightly less effective than continuous full-dose GLP-1 receptor agonist treatments. For employers, the key takeaway is that you don't always need to opt for the most expensive solution to achieve effective health outcomes. The alternative weight maintenance program, even though it was slightly less effective, still provides substantial health benefits and saves significant costs over time. This approach allows you to support your employees' health and well-being without overspending. It's a smart way to balance innovation with affordability in your healthcare offerings, ensuring you provide valuable support while managing your budget efficiently. Our third study is from the Journal of Occupational and Environmental Medicine, Workplace Psychosocial Factors, Work Organization, and Physical Exertion as Risk Factors for Low Back Pain among U.S. workers. Back pain is something many of us can relate to, right? This study analyzed data from over 17,000 U.S. workers and found that factors like high job demand, low job control, work-family imbalance, bullying, job insecurity, alternate shifts, and physical exertion significantly increased the prevalence of low back pain. But here's a twist. Job control and non-standard shifts were only linked to low back pain in workers with low or no physical exertion. So it's not just about the physical demands of the job, it's about how work is structured. Creating a healthier work environment and addressing these risk factors can make a huge difference in your employees' well-being and pain management. Now, let's talk about feedback. The Journal of Business and Psychology recently published a study entitled Paternalism in the Performance Context. Evaluators who feel social pressure to avoid exhibiting prejudice deliver more inflated performance feedback to women. This research dives into the complex dynamics of how social pressure can affect the honesty of performance evaluations, particularly for women. What they found was that when evaluators feel pressure to avoid appearing prejudiced, they often end up giving more inflated and less honest feedback to women. This creates a disparity where men often receive straightforward, honest feedback that helps them improve and move up, while women get overly positive feedback that lacks constructive criticism. This protective paternalism can hinder women's professional development by depriving them of the feedback they need to grow. Remember, honest construction and feedback is essential for everyone's growth. Ensuring all employees receive this can create a more equitable and thriving workplace. Our fifth study, published in the Journal of Obstetrics and Gynecology, investigates a crucial topic: the link between gynecological conditions and the prevalence of mental health and sleep disorders among female employees. Using medical claims data from 2017 to 2021, this research revealed that women with issues like pain, endometriosis, pelvic inflammation, and bleeding are significantly more likely to suffer from mental health problems and sleep disorders. Imagine dealing with constant physical pain and trying to maintain good mental health and sleep hygiene. It's no wonder these women are at higher risk. This study highlights the need for integrated health programs that address these interconnected issues. Employers providing comprehensive support can significantly improve your female employees' quality of life. Lastly, we have a study from the Maternal and Child Health Journal entitled Implications of Childhood Autism Spectrum Disorder for Maternal Employment, United States versus Norway. This research compares how having a child with autism spectrum disorder, or ASD, impacts maternal employment in the U.S. and Norway. The findings? U.S. mothers of children with ASD are significantly less likely to be employed compared to mothers of children without special needs. In contrast, however, Norway's supportive welfare state helps mitigate this employment gap, providing better support for these working mothers. It's really fascinating to see how different policies can make such a big difference. For employers in the U.S., this study suggests the need for enhanced policies to help mothers balance work and caregiving. This is where policies such as flexible work arrangement, providing additional resources for caregiving, and fostering a supportive workplace culture can make a significant difference in helping mothers of children with ASD or other disabilities stay in the workforce and thrive both personally and professionally. Earlier this year, IBI published a members-only study focused on the interconnectedness of mental health challenges across families and workplaces and the importance of comprehensive mental health benefits and a supportive work environment to address the needs of employed caregivers and their families. IBI's report provides actionable insights for employers and policymakers to support the mental health needs of adolescents, young adults, and caregivers, ultimately contributing to a healthier and more productive workforce. Check it out at our website at www.ibiweb.org for more information. That wraps up this episode of Research Roundup. Thank you for listening. We hope you found the insights valuable and the research thought-provoking. If you enjoyed today's episode, please subscribe to our podcast and leave us a review. Your feedback helps us to improve and bring you the content that you want to hear. Don't forget to share this podcast with your colleagues and network. Join us next time as we continue to explore the latest trends and research in employee health and well-being and workplace productivity. Until then, stay curious and keep learning.